Pollution is no longer an environmental issue now, rather it has turned into a severe health crisis. With me to discuss on the same topic is a very special guest. We have Professor Dr Arvind Kumar. He is a chairman, Institute of Chest Surgery, Chest Cancer Surgery and Lung Transplantation at the Medanta Hospital. And he also happens to be the whistleblower behind the entire air pollution fiasco that is right now unfolding in Delhi. Welcome to the show, sir.
Thank you.
Sir, I have a very straight question to ask. Is air pollution in Delhi right now permanently damaging the lung or the heart of the residents?
Thank you for that question. First of all, I would correct you that air pollution is not only confined to Delhi. It's a pan-country problem affecting most of the population in the country. It might have started from Delhi or it might be getting more attention because Delhi is the capital. But today it affects the whole country. That's number one. Number two, air pollution, which has still now been looked at as an environmental or a chemical issue, is a pure health issue. In fact, it's a health emergency where each one of us, from a yet to be born child to an elderly person, is being affected. One. Two, all organs in our body, from brain to toe, are being affected. Two. Three, we are having disease, we are having disability, and we are having premature deaths, the number of which is more than the total number of people who lost their lives in the corona epidemic. So every year, air pollution is causing a corona epidemic, and we are quiet about it. Yes, it's true that these toxic particles and gases, when inhaled, they go and get deposited in our lungs. They settle down there. They not only stay there, they release their chemicals, which passes through the lining of the lung, goes into the blood, and then has its adverse effect on every organ from brain to toe. And no organ escapes the ill effect of air pollution. Brunt of the attack, of course, is borne by the lungs.
So as a doctor in Delhi, have you seen an increase in the number of patients that are more related to pollution?
Yeah. Every doctor in Delhi, if you would talk to them, and that includes pediatricians, pulmonologists, chest surgeons, physicians, anyone who deals with these patients will report to you that we have now much higher percentage of patients who are coming with chest problems, and this gets really worse during the October, November, December time. More importantly, I would report something to you which I have seen personally. I'm a lung cancer surgeon. In the last 30 years, I have noticed a sea change in the demography of lung cancer. If we look back at 30 years back data, 95% of the patients were smokers. They were mostly men, and they were in their 50s and 60s. So it was a disease of elderly smoker men, which was because of smoking. So we knew the cause. Today, if you see, 50% of the patients are non-smokers. Nearly 45% of my patients are women who are non-smoker from non-smoking families, and the peak age has come down by about 15 to 20 years. So I see patients mostly in 40s, few in 30s, and few even in 20s. So from elderly smoking men, it is now a disease of elderly as well as young, smoker as well as non-smoker, men as well as women. And it is because of breathing toxic polluted air. You can even call it breather's disease. So if you breathe in a polluted city, you are at risk of developing lung cancer. So it's a huge health challenge which we are going to face in the next 10 to 15 years.
Do you think people should take preventive medicines or supplements during high pollution days? Are there any preventive medications for that?
I'm not aware of any medicine which can prevent you from having ill effects of these poisons which you are inhaling. No. There are a lot of things which are available on the net. You can do this, you can do that. I don't think any one of them has been proved scientifically to have a definite benefit. People might claim that, oh, I did this, so this happened. But these are anecdotal own stories. There is no scientific study available to say that you expose yourself to pollution, but you do this measure and you will have escape from the effects of air pollution. I'm not aware.
Lastly, what do you think the citizens can do from their end to prevent or to escape this hazard that's going on right now?
So you said to escape or to prevent pollution?
We can't escape. Like living in Delhi, you really can't, because right now we are in Delhi, so we can't escape it.
So let me answer this clearly. If you allow the air to be as it is, and then you say that you will breathe in this air 25,000 times a day. Each one of us breathes 25,000 times a day. You are inhaling air with an AQI of 350, 400. And you ask me, what can we do to protect ourselves? Nothing. You will 100% get the ill effects of air pollution. So the answer lies not in asking a question how we protect ourselves. Answer lies in asking a question how do we prevent the air from getting polluted, for which the answer is simple. The pollution is coming from dust and smoke. Dust, whatever the source, and smoke, whatever the source. We have to act on those sources, reduce the dust coming to the environment, reduce the smoke coming, and bring the pollution levels down. That is the only way forward. And that's exactly how all other cities across the globe, be it London, be it Beijing, have addressed their problem. And we need to follow that. The solutions are there. What is needed is a will on the part of the government as well as the people to implement what we already know. I don't think we need to discover a solution. Solutions are there. The need is to implement them, and implement them brutally for the sake of health of the present and future generation.
So it's right now it is a race against the pollution that is happening to safeguard ourselves.
It's a race against time. The generation is getting affected. This new generation which has taken birth in this air and is breathing this air thousands of times a day is getting the damage in every breath. So it's a race against time. The earlier we correct this problem, the better it is for the health of our people.
Thank you so much, sir, for talking with us. And I hope the citizens, they look forward to, to just taking up new steps to prevent and to protect themselves now. Thank you so much.